Hello, this is Dr. Stanley Lang, and I'm welcoming you to this brief sharing on denial and coronary artery disease. Denial and coronary artery disease. And I'm sometimes known as the whole health doc because the approach that I use to practice medicine is to try to integrate health of body, mind, and spirit, otherwise known as whole health. So the concept of denial that I want to touch on today is something that we've all heard of, but very rarely do we look at our own lives and ask, how is denial at work in my life and keeping me from doing the right things for my health, whether health of body, mind, or spiritual health? So the concept of denial and coronary artery disease I'd like to touch on today because of two different patients that I saw that had some degree of denial, one a lot and some, and one the other one had some denial. And just to give some insight into how this might be happening in your life, and so that you can sort of take action so that you're not a victim of the process of coronary disease that's going on in many, many people, since it's the leading cause of death in the United States and much of the Western world. So the concept of denial is best, I think people best understand it when they think of alcoholism. And if you've ever been around people that are really severely alcoholic, they are usually in total denial that there's a problem. And when I was in training many, many years ago, I worked in a psychiatric hospital, sort of part-time to provide for our family. And the thing that struck me, because this was an inpatient facility, was that there were people that were being admitted involuntarily that were still in complete denial that they had any kind of an alcoholism problem. And it was astounding because they weren't just pretending. They really didn't think they had a problem. And that same process is going on in many people who are dealing with the major effects, the major issues that lead to coronary artery disease. Now, a lot of people mistakenly think that coronary artery disease is mainly a problem related to cholesterol. It's not. Now, obviously, cholesterol plays a role in the development of plaque in the coronary arteries, but that's not the major player. Recent research actually shows that if you look at all of the different things that can be correlated with sudden death or a heart attack, the thing that is the most that correlates by far with that event, a sudden heart attack, is what we call coronary artery calcification. So that means that the arteries have become calcified and stiff, basically. And you can measure this calcium in the coronary arteries with what's called a calcium score using a fast CT scanner. In many countries, this is a standard test done for lots and lots, if not the majority of adults. In the United States, unfortunately, this test is very, very underutilized because it's very helpful in predicting our risk factors, and so we know what to do next if we know what our risk is. But if you look at that one thing, coronary artery calcification, that correlates more than anything with having a heart attack or a cardiac event. And what do you think is the thing that correlates the most with coronary artery calcification? Do you think it's cholesterol? Do you think it's smoking? Do you think it's high blood pressure? Well, you'd be wrong on every one of those. The thing that correlates the most is metabolic syndrome, insulin resistance. Insulin resistance syndrome is by far the process going on in the body that correlates with coronary artery calcification. The higher the metabolic syndrome issues that are going on, the more the insulin resistance is, the higher the rate of coronary artery calcification. Cholesterol doesn't correlate at all with coronary artery calcification. It's the same level if you've got high levels of calcification or almost no levels of calcification. So it's not a factor in risk. It's a factor in creating plaque once you've got a process going on that metabolic syndrome is what predicts. Now, there's different ways you can measure metabolic syndrome, which I've talked about in different videos I'm not going to get into here. The point being, this is a fixable metabolic problem, but people are in denial about how bad it is or whether they've even got it. Now, if you're overweight, the chances are very good that you're in some degree of metabolic syndrome, and yet you probably aren't thinking, I've got a heart attack risk on my hands. And so one of the patients that I saw has a very advanced case of metabolic syndrome and some other risk factors to boot. And he was willing to maybe make a couple of adjustments in his life, but was unwilling to accept that he was sitting on a time bomb, literally. And he is the kind of person that will have a sudden cardiac event. And 40 to 45% of people discover they have coronary artery disease as they are dying because they don't get a second chance. They have sudden death. So that's a pretty high percentage. And the significant thing is it's preventable if you reverse the metabolic syndrome. Can it be reversed? Yes, it can easily be reversed by eating a low glycemic index diet, which is part of the stuff that I teach about all over the place. So if you want some ideas on how to eat low glycemic, just look at some of my other video content and you'll start to pick up how to do that. Now, the other major factor, there's one other major factor that is a huge factor that has to do with risk for coronary disease, and it's stress. Stress. Now, how do we know this? Because of a process that's called the Rosetta Effect. So Rosetta Effect is a phenomenon that was established decades ago in a town called Rosetta, Pennsylvania. And the doctor at that town noticed that his patients didn't have significant amounts of coronary artery disease, yet they were doing everything wrong. They smoked, they worked in a mine in coal mines without filters on, they ate foods that were supposedly bad for the heart, but they had one thing going for them. They had a lifestyle that had much less stress because of the community characteristics. The people lived in tight community. They had close friendships. They had basically all living at the same level in a socioeconomic status. A lot of other measurements of stress, they had a lot less stress. And what they determined was when you have sufficient things going on in your life that decrease stress, that protects against all these risk factors. So you could have all of the risk factors that I just talked about, including metabolic syndrome. And if your stress levels were dramatically low, your risk would be much less. But unfortunately, that's the opposite of what's going on. We're living in more stress now than at any time in history, and it's getting worse. The 24/7 cycle of news that we're all locked into, never on vacation from our phones, all of the different things that we know are causing stress in our life, those are factors right now that are affecting your health. And rather than protecting you from all of these other risk factors by having a low stress lifestyle, we have high stress lifestyles that are actually magnifying the negative effects of these other risk factors. So if you have stress and you have a lot of stress and you're not doing anything about it, you're in denial. If you're overweight and you've got any of the other risk factors, even if you don't have any of the risk factors, and you're not doing anything about it to reverse the metabolic syndrome, you're in denial. And you can do something about it, but you have to admit it, just like the alcoholic has to admit that they have alcoholism. Unless they admit that, they can't go to the next step. And if we don't admit that we have high levels of stress and do something about it, we're just as in the same boat as an alcoholic who doesn't admit they've got a problem. If we don't admit we've got metabolic syndrome when we're significantly overweight, and significantly overweight is like 10 pounds overweight. When you're significantly overweight and you don't do anything about it, that's called denial, because you're carrying around something that is a major risk factor for having a heart attack down the road, because it's a signal that you're in metabolic syndrome, and that correlates more with coronary artery calcification than anything, and that correlates more with sudden death and coronary heart and non-fatal heart attacks. So what can you do about that? Well, like I said, you can explore the resources on my page, my YouTube channel. I've got a lot of video resources there to teach a lot about low glycemic eating to reverse metabolic syndrome. If you want a more comprehensive approach, I invite you to take advantage of the 7-day free trial for my membership academy. It's a very inexpensive way to monthly be part of the academy for as long as it helps you. And that might be for 1 month. It might be for a lot longer because there's enough content in there for more than a year to help establish the strategies that will reverse metabolic syndrome and control chronic stress. There is no other program like it in the world. I can say with a high degree of confidence. So if you're looking for a way to try to reverse these 2 major risk factors at the same time, I strongly encourage you to give this the 7-day free trial a try. And if you decide not to do that, I do encourage you to do something about stress and metabolic syndrome, because the chances are pretty good you've got both of them. So I wish you well. I hope you found this helpful. God bless and have a great day.